everyone, it's Alicia, and today I'm here again with Dr. Bilski of Bilski Dental Group. And today we are talking about gum recession, specifically a procedure that you use for that called the pinhole procedure.
Yes.
So let's talk about that procedure a little bit.
A big problem in the U.S. market for recession or dentistry, period. We'll show some images in a video later.
Yeah.
Recession means that you're losing bone around the tooth and also gum tissue. The reason why you're losing the gum tissue is because of the jawbone receding. So this is in that photo where you're looking now is showing a representation of what we see in a lot of patients. Maybe, I'm not going to ballpark it too much, but it's like maybe 40 years old, you start to see this.
Okay.
This particular picture may be in a 50-year-old. And you're seeing recession of approximately maybe 3 to 4 millimeters.
Okay.
That's kind of the area when we start talking about the pinhole surgical technique, which is developed by Dr. Chao.
Okay.
Dr. Chao is a general dentist and an attorney.
Okay.
And he figured this out, and it's a non or less invasive way of lifting the gum back to where it needs to be around the white part of the tooth, the enamel, and cover the roots so you aren't susceptible to root caries or root decay, which could create more gum loss, or root canals, or tooth loss. So how can we fix this? So Dr. Chao, what he does is places a little pinhole and trains dentists how to do this, which I was trained personally by Dr. Chao and licensed to do that. So only doctors that have trained with Dr. Chao can perform this or talk about it.
Okay.
So it's a pinhole. The tissue is elevated, loosened, and packed with a collagen. It's very simple.
Okay.
So there's very little downtime. There's less bleeding. Oftentimes without stitching or sutures. You can do multiple teeth or you can do single teeth. You're going to have a healthier and a more attractive smile. So those are a lot of the key points that I think is really good about the pinhole surgical technique, in contrast or comparing it to having the roof of your mouth, the gum tissue taken from there, which is actually more painful than you would ever want to imagine.
Wow. And
it's not really that effective. It's about 50% success rate. Pinhole's a little bit greater than that. And there are certain limits to any procedure, but in our practice, pinhole is one way that we can do it. We tend to use that for those that have less of a recession, so that 2 or 3 millimeters. When you start getting to 5 or 6 or 7, we talk about dermal grafting or gum lifting. So there's 2 other procedures with other material that we use along with some stem cells that we use. Okay. So all of this that we're talking about, pinhole, is very less invasive. Patients seem to respond very well to it, and they agree with the procedure. It's not invasive, so they like it.
Okay. So, you mentioned that this gum recession might start happening around the time you're 40. Could be earlier, maybe a little, or maybe later, or maybe not at all. But this pinhole procedure would be something that if you catch it early on, you could come in and utilize this.
That would be the idea. So if you're coming in to see me or another dentist, and at least twice a year, they should be talking about that. What we find, though, is that a lot of dentists don't know about this procedure, and all they know is taking the gum from the roof of your mouth, which they don't really want to send their patients anywhere to have that done unless it's severe. So it actually goes too long, where it could have been corrected very simply with 1 or 2 teeth possibly. That's kind of like anything in medicine or dentistry. Until there's more awareness within the own industry, our own industry, the end users or the consumers won't know about it. Yeah. And my intention here with this is to just give you an example of something that we do.
A lot of your videos are just about spreading awareness of the different procedures and all the things that you know. You want to share that knowledge with others in the industry as well as patients.
I think, like anything, prevention is better than fixing at the end of the day. But sometimes you have to fix, and a lot of times we do fix, and it's a scary place, and we understand that. And this is a very nice procedure that most people recover very well from. So.
Wonderful. Well, thanks for telling us a little bit more about that. And if you would like to schedule an appointment with Dr. Bilski or Dr. Timmerman at Bilski Dental Group, you can get in contact with the office by giving them a call to schedule an appointment, or you can find out more online at bilskidental.com. Thanks again.
Thank you.